Hello, my name is Brianna Burney and I am a student at Chandler Gilbert Community College. Welcome to my lesson on avoidant personality disorder. What is a personality disorder? As defined in the textbook Experience Psychology, a personality disorder is a chronic maladaptive cognitive behavioral pattern that is thoroughly integrated into an individual's personality. And because it is fully embedded in an individual's personality, it makes it difficult to treat. Personality disorders are relatively common, with about 15% of U.S. citizens diagnosed with it, according to the textbook. There are a total of 10 personality disorders. If you go to page 478 in your textbook, you can read about the 10 different types of personality disorders that have been recognized by the Diagnostic and Statistical Manual of Mental Disorders, or DSM for short, provided by the American Psychiatric Association. What is avoidant personality disorder, or AVPD? The textbook defines AVPD as someone being socially inhibited and prone to feelings of inadequacy, anxiety, and shame. These individuals feel inadequate and hold back in situations. They have unrealistic standards for their own behavior and avoid setting goals, taking personal risks, or pursuing new activities. AVPD can also be driven by the fear of rejection. It is associated with significant distress, impairment, and disability. AVPD is one of many understudied illnesses, and because it is understudied, many psychologists argue about whether or not AVPD is a severe variant of social anxiety disorder or if it should be recognized as a distinct diagnostic category. AVPD is labeled as a chronic illness, meaning it can affect someone anywhere from a few years to the rest of their life. A moderate diagnosis is determined by a clinical psychologist or psychiatrist. Clinical psychologists or psychiatrists rely on the DSM to evaluate individuals. The DSM offers a criteria list to represent specific symptoms an individual with AVD possesses, and to be diagnosed as such, that individual must meet at least 4 of the listed criteria. People with a moderate diagnosis can maintain the ability to function normally and do not completely disassociate with society, so they have a chance to prevent further damage if they seek treatment. As of today, AVPD can be treated, but there is no sign of a cure. Listed are these 7 items of the DSM criteria. This is used to evaluate an individual suspected of AVPD, where they must meet at least 4 of the 7 on this list. AVPD can affect the mindset of an individual from a small to severe degree. People suffering from AVPD are evaluated based on these 3 concepts: personality functioning, interpersonal functioning, and pathological personality traits. In reference to pathological personality traits, AVPD exudes specific detachment characteristics, withdrawal and intimacy avoidance, as well as bearing a constant negative mindset that leads to extreme anxiousness. Most severe cases of AVPD are diagnosed by a clinical psychologist or psychiatrist who has spent a lot of time with their patient and gotten to know them. A severe case of AVPD can develop from a direct physiological effect of substances, for example, drug abuse or medication, as well as medical conditions, and in this case, head trauma. Severe cases suffer from the inability to feel pleasure or anhedonia. Many severe cases develop from not receiving any sort of treatment, which ultimately destroys the chances of an individual regaining some amount of normal functionality back. There are various misconceptions regarding AVPD, but for the sake of time, I will only introduce 4. Number 1, AVPD diagnosis is less stable than most personality disorders. This is incorrect. AVPD diagnosis has been moderately stable and has supportive research indicating that AVPD is not less stable than other personality disorders. Number 2, AVPD describes someone who is shy. AVPD goes beyond just being shy. As I mentioned previously, AVPD inhibits someone socially because of their developed fear of rejection. Number 3, AVPD describes someone who does not like people. This is not entirely true. It is the fear of rejection that affects a person's ability to communicate and connect with other people. People with AVPD are often described as longing for friends but feel as though they cannot trust anyone. And number 4, AVPD is another term for social anxiety. AVPD is not another term for social anxiety. Instead, it has been argued that AVPD is a variant of social anxiety disorder. There is a little research into treatment for AVPD specifically, with most research derived from treatment of social anxiety disorder. For example, pharmacotherapy, cognitive behavior therapy, and social skills training. Pharmacotherapy is the treatment of a disorder with medication. Although it is not an assumed effective treatment for personality disorders, this is medication that can assist with serotonin-specific and serotonin noradrenaline reuptake inhibitors. CBT has been reported to be helpful, but the amount of case reports are small and have been deemed more effective if attention is put into developing a relationship through a threat-avoidant approach. Social skills training has been reported to be more helpful if an attempt is made before it develops into a severe disorder and can result in long-term therapy. So what is the most effective treatment? Given the lack of research involving AVPD, a problem-focused approach is the most effective way to develop a treatment plan specific to the individual's symptoms, emotional function capabilities, relational function capabilities, or the attachment style, and current coping strategies. In conclusion, development and testing of interventions that specifically target AVPD are urgently needed. If you wanted to read more about AVPD, here are the links to my references. I am Brianna Burney, and thank you for watching my lesson on avoidant personality disorder.